Hello, I'm Daniel Adibi, and I'll be your host for Our World 101, the show in which we discuss complicated, real-world events and issues to bridge people together. Today's topic is refugee health. Recently, we have seen an influx of refugees coming into the United States, and just like any other population, they need good access to healthcare. However, they are particularly vulnerable because of their hard journey from their country of origin and other impediments to good access to healthcare, such as transportation, childcare, and a language barrier. Health is a basic human right, and this problem is one that needs to be solved. One person helping to solve this problem is Dr. Marc Altshuler, who is a director of Refugee Health at Jefferson. Jefferson is the largest refugee health care provider in the Philadelphia area and is one of only 4 programs recognized by the CDC as a center of excellence in refugee healthcare. So, Dr. Altshuler, welcome to the show. We are really excited to have you here.
Thank you, Daniel, for inviting me today.
To start off, how did the refugee health program at Jefferson get started?
Sure. So I've been faculty here since 2004. And in 2007, we were approached by some community partners at Nationalities Services Center, which is one of 3 refugee resettlement agencies in the city. They were really struggling to get healthcare access. And the fact that they're located very close to Jefferson made it a nice, easy process to have their clients seen by us. At the same time, we also had a number of our residents who I'm the residency director or the program director for family medicine. So a number of our residents were interested in providing care. So we decided to do a trial, like 6-month period of seeing the refugee clients in our office. And really after the first day, we were sold. So that was 2007, 15 years ago. So we, a number of grants later, we're now, as you mentioned, a very large provider of refugee healthcare. And we've seen several thousand refugees in the past 15 years, which has been remarkable.
Yeah, that is amazing. What inspired you personally to go into refugee health?
So I went into family medicine, and in particular, I wanted to be at Jefferson because I really enjoy working with just patients that are struggling and that are vulnerable. And I wanted to work in an urban environment where I could take care of individuals who were struggling to access care, and I wanted to make a difference. So that was a lot of the work I did in medical school. And to be honest, I didn't have, I finished medical school and I did all my training at Jefferson, and I was here seeing patients. I'd be lying if I said I came to Jefferson to work on refugee health. It wasn't really happening. But really, once I sat down with refugees, with refugee patients, heard the stories of what they went through and some of the atrocities they faced, and knew that they were now here trying to start a new life, I realized that it was a group of individuals that I really wanted to help them any way I could. And honestly, once I started, I have not stopped. And by far, it's been the most rewarding clinical experience I've had in, over my 20-year career at Jefferson.
Yeah, and can you tell us a little bit about what you do as a director?
Sure. So I'm the director for our Center for Refugee and Immigrant Health, which is really kind of overseeing seeing the patients with our residents. Part of the design of our center was not only were we going to provide the best care we could to the refugee community, but we also wanted to create an environment where we could actually train medical students and residents on how to take care of people from other parts of the world. So the center is really comprised of a few different areas. One is the clinical part, meaning the parts that we, seeing the patients in our office, being their doctors, taking care of them. The other part is doing some research under our center. So we've been doing research with the CDC, or Center for Disease Control, to try to figure out how we can provide better care to this community. And then the third part is really working with the community to see what their needs are. Because sometimes as healthcare providers, we think patients want one thing and they really want something else. And I'm sure we'll be talking about today, we opened up a health center in the community that was really based on the needs of the community, because even though we were providing great care in Center City, many individuals were struggling to access care. So we wanted to put the healthcare in the community to make it easier for them.
And when you are seeing refugees, what are you typically treating? So, for example, are you doing a lot of preventative care or treating like infectious diseases?
That's a fantastic question. So it's interesting. When we first started, all the recommendations were to look for really infectious diseases. But to be honest, many of these individuals, yeah, there were some infectious diseases, but more importantly, there were individuals who really didn't have access to primary care doctors, or, the children may not have had the same may not have gotten the same care that we got when we were kids from our pediatrician, and the adults didn't have the cancer screening. So we do look for infectious disease and we treat it. So a couple diseases that we commonly talk about with our patients is latent tuberculosis, which is a type of lung infection, but it's not infectious. We see hepatitis, which is a liver disease. We see a lot of mental health related to what they've been through. Then we also see diabetes, we see smoking, we see high blood pressure, we see heart problems, we see kidney problems. So we really try to do everything for the patient, because for many of them, they haven't had access to a doctor for years and years, and maybe not their entire lives. So we're trying to do as much as we can.
Yeah. And you mentioned that you do some mental health services. Can you tell me a little bit about that? Because I know that refugees are particularly vulnerable because a lot of them have been through, some level of trauma or alienation or separation. So can you tell me a little bit about that?
Sure. And that's a great question as well. So you're right. Refugees have been through a lot of trauma. And, we do a couple things. I would say, first of all, we want to provide them with a safe space. And for many of them, just knowing that they have healthcare providers that can take care of themselves and their family gives them some sense of relief. We want them to feel comfortable talking about their mental health. In some countries, it's kind of taboo to talk about, whereas in our country, we obviously encourage it. And we check in on their mental health on a regular basis. And it's not only asking questions about their mental health, but asking them about, how they're sleeping. Are they having recurring nightmares of what happens? It really depends on the individual. Some individuals come here and they have loved ones back overseas and they don't know what happened to them, so they worry a lot. And if we're not able to provide that care as a primary care doctor, then we usually work with several other providers to get them some of the mental health services that they require. What I have seen, though, is for many refugees, the first 90 days they're here, really, really tough. So if anyone took you or me and took us out of our home country and placed us halfway around the world with no one around that we knew, and we spoke different languages, we would really struggle as well. So the first 90 days are tough. So we try to provide a lot of services and support for them. And then if they continue to have symptoms after those 90 days, those are really the individuals that we target, because those are the ones we know are going to need some extra help.
Yeah. And it's, as you said, you can't imagine how hard it is to, be away from your home and be somewhere where a lot of people don't speak the same language as you. So.
Yeah, no, it's, I could not imagine what these individuals have gone through. So whatever we can do to make it easier is what we should be doing.
Yeah. And I can also imagine that a lot of the refugees might have been victims of torture from oppressive regimes or from persecution. Is there a program at Jefferson Refugee Health for victims of torture? So
there is with our collaboration with Nationalities Services Center, which is the resettlement agency, they have a special program for victims of violence or torture. Some countries have more of it than others. And we kind of know that. We try to be very careful because for some individuals, they feel comfortable talking about it. Other individuals, they don't. So we use some clues that we've kind of learned over the years to figure out if they want to talk about it. And more importantly, we just want them to know that they have a safe space. There are some individuals who came from countries where they were afraid that if they told their doctor something, they could get in trouble or it could come back to them. And we need them to know that it's different here. And everything they tell us is confidential and we're not going to tell anyone. So usually over time, they feel comfortable and they trust us enough to kind of share with what they went through. And then if they want to get treatment, we can get them treatment.
And which countries are most of the refugees that you see? Where are they mostly coming from?
So it kind of changes every year. It really depends on what's happening over the world. I would say in the past 15 years, the three countries that we've seen the largest numbers from would be Iraq, Burma, and Nepal. But we've actually at our center seen refugees from over 30 countries. This past year, we were really busy seeing many individuals from Afghanistan. As you know, with Operation Allies Welcome, 70 plus thousand Afghanis were resettled in the United States. Around 600 came to Philadelphia, and we saw over 300 of them. So we were really busy this year seeing Afghani, but I've also seen individuals the past few weeks from Ukraine. I've seen them from the Congo. I've seen them from other areas. We've seen them from Iran, you name it. Most countries we've kind of seen. And we even actually have, in our new center, we have a map on the wall, and it's on a bulletin board. So when patients come in, we have them take a pin and put it in so we can kind of see where our patients are coming from.
Yeah. And how do you typically get the word out to refugees about your program?
So, we work closely with the refugee agencies that bring them here, and they're the ones who kind of coordinate getting them their initial examinations. In addition to that, we use community health workers that we have for just outreach in the community, because at our new center in South Philadelphia called the Vice Wellness Center, we see not only refugees, but we really see a much larger immigrant community. So we may be advertising through different organizations that serve those different groups. We'll use community health workers for word of mouth. And I just think over time, people just start to talk and tell people where to go, and then they kind of show up, which is kind of nice.
Yeah. And I guess talking about your residents a little bit, how are you training your residents to take care of the refugee population, and how does it differ from other residents training?
So we do a number of things. We made a commitment that this was a community that we wanted to take care of. So when I create the residents curriculum, so my residents are with me for 3 years. Refugee and immigrant health is built into their curriculum. And when I say curriculum, that means it's built into some of the lectures that they go to. It's built into their experiences. So we have a way of creating it so that the residents spend portions of all 3 of their years working with the refugee community. And a number of those refugees then identify those residents as their primary care doctor. So the residents may take care of them when they see them in the emergency room, or if the patients become pregnant, they may take care of them and deliver the baby, or they may see them in the hospital. We feel it's very important that our residents learn how to take care of all members of our community. And if the refugees and immigrants are part of the community that our department is focused on caring for, then our residents are going to kind of get that training. And there's also a lot of great resources that we have online with some of our partners that we also use to kind of help with education.
And how do you teach cultural competence to residents? Because obviously when you're working with refugees, you need to understand that there are different religious beliefs in different communities. So how do you teach that to residents?
I would say we still try to teach that with some didactics, but I would say that the majority of it is really kind of on the go learning. So, I'll sit down with the residents. We'll talk about the patients that are coming in. We'll talk about what countries they're from. Are they coming from a country where torture is much more common, or rape is more common? Or is it a country where it may have been a little more peaceful? Or is it a country where there may be exposures to alcohol and drugs? So we kind of have that kind of background on our own. And then when we sit down to talk about those patients, we do that. And we dedicate a lot of time so that our residents and students can really spend the time asking those kind of questions to see what concerns those individuals have and what their beliefs are and how we can do that. Just because they're in our office in Philadelphia doesn't mean they need to follow all of our rules. I usually try to tell them what some of our recommendations are, but at the same time, I want to respect their culture. So we try to find a middle ground if that's the case.
And I want to talk a little bit also about the social aspects of access to healthcare. So one of the limits that the refugees might face is a lack of transportation. Is this a problem you face? And are there organizations that help bring refugees to their appointments?
Yeah, so the refugee resettlement agencies in Philadelphia really kind of coordinate that and get them to the appointments. They quickly learn how to use public transportation because they need to learn that not only to get to my office, but also they may need that to bring their children to school because most of their kids are going to public school in Philadelphia. They may need it to go to the store. They may need it to go to their job or their employer. So they're taught when they first come here. They get an orientation the same way. If you start a new school, you're getting an orientation or a tour of the school. Well, they get an orientation on what it's like to live in the United States. And part of that is learning public transportation. They usually can pick up on Uber pretty well on how to figure that out. So it's not as much of a barrier as it used to. And then sometimes I'll see patients and they're like, oh, I walked a mile to come to you. But for them, that was normal because where they're from in their home, they may have walked 5 miles to go to the doctor's office.
Yeah. And what about the language barrier? Does that ever get in the way of communications between the doctor and patient?
So language barriers is probably the biggest challenge that refugees face. What we, because we see so many people from so many different countries, it's hard to have in-person interpreters for everything. So we use we have two different ways to kind of communicate. We have an interpreter account with a phone service where the interpreter's on the speaker. And the same way you and I are talking face to face, we have the phone next to us and I will say something, the interpreter will listen, and then they will interpret it for the patient and the patient will say it back to me. And then we also have that on an iPad that we can kind of bring into the room or any place we are, and we can use the iPad to get an interpreter really from any place all over the world. But as you can imagine, when you look around, most things are in English. So it makes it really hard for individuals. Even if I spend a lot of time and I may give them instructions on how to get from my office, say, to go get an x-ray, they may get to the x-ray department. And when they look for the word x-rays in English, and they may not be able to recognize it.
Yeah. So
we utilize a number of members of the community, as well as different community health workers and people from these agencies to really help almost kind of hold their hand to take them from place to place to make sure they get there. And then once they've done it once or twice, they're usually pretty good. Yeah.
And that is something really important because it's so hard for them to come from another country where they don't speak the same language. And
yeah.
It can be hard to get around without knowing a lot of English. So.
Yeah. And just trying to navigate our healthcare system, it's kind of confusing.
Yeah.
Or it's really, really confusing. And I always say it's confusing if you were born in this country and English is your primary language. So many people get confused. Well, what about if you're not from this country and you don't speak English? It's even harder. So we try to do as much as we can at our center in South Philadelphia. We try to bring a lot of services there for them because we know it's hard. Once they get out the door, we can't control what happens to them.
Yeah. And for how long do refugees get their medical services covered?
So it's really changed over the years. When we first started, they would really only get it for the first 8 months. Mm-hmm. But now with plans like Obamacare and others, they're usually able to get medical assistance for longer. And then it also depends on their job. So they may get a job where they get insurance. There are some individuals who don't get, who may not be able to have it long term. And then we have to try to find other ways to care for them.
Mm. And if refugees need to find medical insurance, as you said before, it can be really hard to navigate their way to do it because they don't know a lot of English. Are there people that help them? Are there people who help them with that?
Sure. So actually in Philadelphia, the Department of Welfare is really wonderful at helping individuals get insurance, but they also may show up at the resettlement agencies that brought them here. They may come to our office. If they show up in my office, they'll sit down with one of our social workers who will help them fill out the applications. So there's a lot of people who want to help. So usually when they are struggling, they'll kind of come to one of those places, sit down, and then someone will really sit down with them and help them apply for the insurance, or they may help them enroll the children in school because there's forms to fill out, which once again are in English.
Yeah. And it's hard for most Americans to navigate their way to get medical insurance and other things. So it's really, really a great thing that there are organizations helping refugees with that.
Yeah, it's really incredible to see how many people want to help them.
Yeah.
It makes you feel good about what's going on, even when we live in a little bit of a crazy world.
Yeah, definitely. And I know you've also, you've seen countless numbers of refugees in your clinic, and you've heard a lot of their stories, but just wondering, what was one refugee story that maybe stuck with you?
Oh, that's a good question. I would say there was a family from Nepal that came. It was a husband and wife and their 4 teenage kids. And they had twin daughters who they had just turned 18. One of them had a heart condition and one did not. The one with the heart condition was probably 4.5 feet tall, and the other daughter was 5 feet tall. The one with the heart condition probably weighed 75, 80 pounds because she just didn't really grow well. And they came to Philadelphia because she really needed heart surgery. She needed a high level of care. And I remember walking in to the family to introduce myself. I said, I'm the supervising doctor. Welcome to our office. We're so happy to be here. And the father very proudly, everyone was sitting down. The father very proudly stood up and he walked over, and with the use of an interpreter, he said, the health of my family and my daughter is in your hands. Thank you so much for taking care of us. And it really meant something. I mean, there's a lot of stories, but to know that I was a complete stranger, but he knew that he was coming to a place. There was, he was informed that he was going to be coming to meet his new healthcare providers who were going to do everything in their power to take care of them. And when he came in, he just kind of gave us his blessing to take care of his family. It was really emotional and powerful. And she wound up getting surgery at Jefferson. She had some valves in her heart replaced that were not working. And she wound up even getting married and having children of her own. So that's probably just one of a number of stories that I could tell you about. We don't have enough time today, though.
Yeah, well, it is. I mean, I can see it's such a great feeling to help a family like that and to, help their daughter and make it. It must be really rewarding.
It's very incredible to know that you can try to help individuals out. It can also be frustrating knowing what people have been through and knowing that people are not treated equally. But then that makes you want to try harder to help them out. Yeah,
definitely. And to wrap up our discussion, is there any way that we as individuals can help support Refugee Health and support your organization?
So honestly, I would recommend if people are interested in supporting refugees, yes, health is very important, but fortunately, they're able to get insurance, which can get them the health services they need. But there's not an insurance that gets them enough food. There's not an insurance that is going to maybe get enough clothes or school supplies for the kids. So I always encourage individuals who want to help out the refugees that are coming here, whether it's the Afghans who came here, whether it's the Ukrainians or the many other refugees, is to reach out to the refugee resettlement agencies, because they are always looking for financial support and donations that can then go directly to the refugees. So I would recommend that people either visit the website of Nationalities Services Center or HIAS, HIAS. Those are the two largest refugee resettlement agencies that really do a lot of amazing and incredible activities and services for the refugees coming here. So I would strongly encourage people to check out their websites and consider making a donation or volunteering or providing some support that they need. Yeah.
And knowing that you've helped a refugee can really be a rewarding feeling. So, yeah, it's definitely a good
Absolutely.
thing to do. Well, we've had a great discussion about refugee health and what the Jefferson Center of Refugee Health is doing to help. Dr. Altshuler, thank you again so much for being on the show. It was a pleasure having you here.
It was an absolute pleasure. You did a phenomenal job. So thank you so much for inviting me.
Yeah, thank you. To all of our viewers, I hope you'll join us for our next episode. I'm Daniel Adibi.